Call the meeting of the LaPorte County Board of Health to order. Today is January 14th, 2020. We'll start with the Pledge of Allegiance, then go on to the roll call. Pledge of Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, roll call, please.
Mrs. Thomas?
Present.
Dr. Uhas?
Present.
Dr. Dora?
Here.
Ms. Vaughn?
Here.
Mrs. Arnold?
Here.
Mrs. Sandy? County Councilman Mr. Mullenhour?
Here.
Thank you.
Thank you very much. The next item on our agenda is the election of the president and vice president for 2020. What I'd like to do is start with the president nominations, and then we'll do votes, and then we'll do the vice president. Are there any nominations for president?
I nominate Dr. Uhas.
Okay. Any other nominations? Okay, let's put any discussion. Tomatoes? All right. All in favor?
Aye.
Any opposed? None being opposing. Thank you very much. Be my pleasure to serve again. Vice President, any nominations?
I nominate Ali Long.
I second. Are there any other nominations? Nope. Okay, then no discussion. Vote. All in favor for Ally, Vice President?
Enthusiastically.
All in favor?
Aye.
Okay, anybody opposed? The ayes have it. Thank you, congratulations.
Thank you.
It's been great working with you. All right, next, I have a little announcement to make. It's a little bit off the schedule right now, but I'm very pleased to report the commissioners unanimously reappointed Dr. Dora and Monique Thomas to the Board of Directors of the Board of Health for the 2020-2030 term cycle. At this time, a replacement for Dr. Houck's remaining term of his 2017-2020 appointed board position has not yet been determined by the commissioners. A decision and accepted offer should be forthcoming within the next few weeks. Okay. Next, I'd like to go on to the appointment of legal counsel for 2020. Are there any nominations for legal counsel? I would nominate Shaw Friedman and Associates.
I'll second that nomination.
Okay. Any discussion? All in favor?
Aye.
Okay. And anyone opposed? The ayes have it. Thank you for your service, Mr. Picardo, and we'll continue on with your fine work.
Thank you for the appointment.
The next thing I would like to do, I'm going a little bit out of sequence, but Dr. Houck has been kind enough to come back today, and Tony has a few words of gratitude for you, and I will too, so. Mr. McKinsell?
Thank you very much. Dr. Houck, it's been a pleasure having you on serving for the board, the community, and the staff at the health department. I appreciate your 8 years of service, and you were very helpful to the board and all the decisions we make through the county, so I'm not good at these things. So thank you very much for, and then Dr. Uhas has a little, recognition.
It's for you from the health department and the board for your wonderful 8 years of service, Dr. Houck. You've been a great leader, an exemplary role model, level-headed, and an inspiration to us all. And you were a big help to me when I first came on the board. So thank you for your 8 years of diligent service for the people of LaPorte County, sir. Thank you.
I would say that this board is a dedicated board. I've really been impressed over this length of time. The staff is most professional. It's been a good time for me, and I've enjoyed it very much. Thank you.
Thank you, sir.
Thank you, Doctor.
I appreciate you sitting here next to me, Emeritus, but I know if you have to leave, because we got a late start, so you,
I want to
anytime.
hear what goes on.
Sure. That's the big cowboy now. All right. Going back up the agenda, before I forget, the approval of board minutes from the October 22nd, 2019 meeting. Is there any discussion about the board minutes from the October meeting? If not, I can hear a motion, entertain a motion to accept.
I move we accept the minutes from the October 22nd meeting.
All right. All in favor? Aye. Anyone opposed? No one opposed, so the board minutes from October 22nd, 2019 are approved. Next, public comment. Do we have any public comment? For the third time, is there public comment? Hearing none, we will move on. Dr. Ducey, Health Officer's report, please.
One of the first things that is up here is talking about the antibiotic resistance issue. The World Health Organization says it's one of the greatest threats to humanity at this point because there are so many bacteria that are now resistant to our common antibiotics. There's a lot of things that were simply treated before in the past that we just either have to go to the expensive, more complicated medication regimes, often in hospital, where before we could just give someone an antibiotic. This has come about primarily because of overuse of antibiotics, both in agriculture and in general practice. In a lot of countries, you can just buy them indiscriminately. So, and of course here, there's been an awful lot of, over the years, penicillin was the cure for everything from the common cold to a sore toe. So we've certainly contributed to it as the medical profession also. And again, people insisting on having it and being given it too. So it's a big deal. And they're working on a lot of different ways to try and combat it in different places. As much as anything, education. Do not try and force your doctor to give you an antibiotic. Doctors, nurse practitioners, don't give them out. Don't take anybody else's. Don't finish them the way they're supposed to. They don't cure common cold. And so it's in a lot of places it's a very serious issue, including here. It is also flu season, as we all know. It is not as bad as the 2017 season. My little notes here. As the 2017-2018. At this time, we've had, these are the reports that were put out by the CDC for week 1, which ended January 4th, and it came out, the reports come out on the 10th, so there'll be a new one coming up pretty quick. But for Indiana, we've had 22 deaths that in this report. Jenny, you may have heard a few more, but that's it. This time last, in the 2018 flu season, there were 79. We, in the United States, there has been, they figured 9.7 million people that have had flu-like illnesses. Not everyone is tested, so you can't always be absolutely certain. But the ones that are being tested, there is more influenza B around, and they feel that that's probably why the death toll is lesser, because influenza B generally affects children and young adults, and there has been 32 children die so far, and there has been about, the last number I saw was 4,800 people die from influenza at this time. So basically, get a flu shot, get a flu shot. We've all seen that story on TV that the woman thought her children were protected because she had a flu shot in March. So again, it comes down to, as physicians, encouraging people, as public health officers and workers, to making sure people are getting the flu shot. It doesn't always work the best it can, but there certainly is a lot better than not having it at all. So that's probably one of the big things. This week, they expect the numbers to be down. For whatever reason, it does seem to be coming down. The number of flu-like illnesses, the number has been lesser, so hopefully we've peaked, but they're not peaked for the moment anyways. That will be maybe perhaps another late peak again. Again, we still have measles around, and the biggest issue with this, of course, is getting immunizations. There are some school districts that are now saying if you are not immunized, you cannot be in our school district. There's none in Indiana that I'm aware of, but in other states, they are starting to enforce it, that you cannot come to school without your immunization. So obviously that's really important at this time. And I think it's my main issues at this point. Wash your hands, everybody.
Thank you, Dr. Ducey. Are there any questions for Dr. Ducey? If not, we can move on to accept her report if I hear a motion.
Motion to accept.
Second.
Okay, all in favor? Aye. Anyone opposed? The ayes have it. The health officer's report is accepted. Mr. Mancuso, the administrator's report, please.
Okay, first of all, thank you, Dr. Howe, for the service.
I should have said that.
Yeah, the staff and everybody appreciate your 8 years of service. So we would also like to report that the reclassification for the clerical positions was approved by the council. So we were able to get them from a COMAT 2 to a 4, so that's a significant pay increase for the amount of work they were doing. So that was approved by the council. The employees did not receive raises, but we all were awarded a $1,000 bonus. And part-time people were awarded a $500 bonus. So instead of getting a raise, the council gave us a bonus for $1,000. So, thanks, Mike. Moving on. December 6th, we had the open house for the water lab. We had probably 75 people came through. I'd like to thank Commissioner Morzinski for attending, and Councilman Mulholland and Rosenbaum, if I said his name right, for showing up too. So it was pretty much, we had quite a few people from the public that showed interest, so it was kind of nice. Cindy did a great, Cindy Ebert, who is the technician there, basically gave everybody a tour of it and explained what was all going on. Amanda has pictures in her report, so you'll see all the nice pictures. And lastly, our two big grants that we get every year, the Local Health Maintenance Fund and the Indiana Trust Fund accounts, were state did approve it, so we will be receiving that money in 2020. That's my report.
Thank you, sir. Are there any questions for Mr. Mancuso? If not, I'll entertain a motion to accept his report.
I make a motion to accept
Is
this.
there a second?
Second.
All in favor?
Aye.
Anybody opposed? No one's opposed. The ayes have it. Mr. Mancuso, administrator's report is accepted. Nursing supervisor's report. Nurse Jennifer Smith, please.
Good evening. We began a program with the Juvenile Services Center, and it's just starting out, so we have a few little bumps to work out, but we are working in conjunction with the nurse at that facility to offer confidential services testing for the residents there, which is urine testing for chlamydia and gonorrhea. We're doing this because we believe that's a vulnerable population that we can reach, and to try and reduce the amount of STDs in the population of that age. Like I said, we just started this program and we've already been finding a high positivity rate, so we have to work out the treatment because the residents out there are leaving before they're being able to be treated, because sometimes they don't know when they're going to be released. So we're working that out, but we are positive that this is going to be a good program between the two facilities. We're wrapping up our annual flu vaccine clinics, and as the demand for the vaccine has waned, usually people are right on it in the fall, but as the season goes on, they're not as excited about getting their flu vaccine. So we still have an ample supply. So an opportunity came about that the PADS program contacted us. That is the Public Action Delivering Shelter program that works with the homeless population. And we were able to offer those clients free flu vaccine at our Michigan City office. Now I understand there is one in LaPorte, so maybe next year we can reach out to them as well. But that's a good program that we can reach out to maybe offer this vaccine to that population. Our Partners for Healthier Babies group met this quarter, and our subgroup is before pregnancy. And we decided to create a survey to be distributed throughout the community to try and determine why young people don't establish with a physician and they use more convenience type clinics. The minute clinics, urgent care. They're finding that the lack of wellness screenings and preventative health care are impacting people when they decide to start a family. They have chronic diseases, and then that passes on to the health of their baby. So we want to do this survey to see what could possibly be done to overcome these barriers with people not establishing with a doctor. The CDC recommends all pregnant women receive flu and Tdap vaccine during each pregnancy, and they have found that only 35% of women are getting both of those vaccines. So it's very important that they receive both of those because influenza and whooping cough are deadly for infants. We have been a yellow fever provider for many years, vaccine provider, and the Indiana State Department of Health decided that, well, it didn't decide, but we're aware of new requirements from the CDC that each provider had to do continuing education and reapply to be providers. So we were able to do that, and we completed the requirements, so we are able to continue offering that vaccine once it becomes available again. We did an on-site lead testing clinic at Lake Hills Elementary School in Michigan City during their parent-teacher conferences. The Michigan City area school board passed a requirement for this school year that all kindergartners had to show proof of a lead test upon enrollment in kindergarten. So we were there for 4 hours and we tested 8 children. None of those tests were elevated.
Good deal.
And as Dr. Ducey was saying about the measles, the World Health Organization shared that there have been over 660,000 cases of measles in the world in 2019, which is a 240% increase of all of 2018. This is the highest number of measles cases in the United States in over 25 years. We urge everyone to be vaccinated with the MMR vaccine to prevent the vaccine, or prevent the disease. It's vaccine preventable. That's my report.
Thank you. I have a question about your vaccine, the flu vaccine. You guys track the rate of people getting flu vaccine.
We track the numbers that, yes.
Do you also share data with like the pharmacies that are now offering flu vaccine to know?
We don't
like
share
how-
our data with the pharmacies.
I mean, do they give you any of their data? No?
No.
Okay. Because I realize that there's another source of that
There
now
is.
going on, and they were offering the one for seniors.
Yes. It's readily available, but pharmacies and health departments and pharmacies are not required to put in adult vaccines in the registry. So I don't think there's a good way to track that. They can put it in, but they're not required to. But that would be a good way to track it.
Yeah. You know, it just seems like they would want to share that, you know, generic data, not obviously confidential
Right.
and all that, just so we have a little bit better idea of LaPorte County flu vaccine
Coverage?
penetrate. Yes.
Usually it's about 50%,
Oh, okay.
roughly.
Right.
Historically, it's been about 50%.
Okay, thank you. Any
I
questions?
have 2 questions. One, the MMR. Are there any boosters that we need as an adult?
No.
And
Once
the
you've
second-
had 2 doses.
Okay.
There's no booster recommended.
And the second question I have is why was Lake Hill School selected? Because like Lake Hill School is in an area that's primarily newer builds and not so much rentals.
But they're also in an area with a lot of older homes, and that is in the lead risk map area with the highest area of older homes and poverty.
Okay.
Mm-hmm.
And actually the schools, the Michigan City area schools selected that site for us to go to. We did NAP last year.
Any other questions? If not, do I hear a motion to accept the report?
Motion to accept.
Okay, a second? To accept?
I'll second that.
Okay, all in favor?
Aye.
Anyone opposed? No? The ayes have it. Nursing supervisor's report is accepted. Environmental health, food supervisor's report. Hi, Amanda.
Hi, good afternoon. Yeah, so kind of a busy quarter. It's always a busy quarter. Everything coming to a head at the end of the year. We did something new last year, and we hope to continue it. And that was having a team building work exercise in conjunction with Porter County Health Department. I've been here, it'll be 16 years, and we've never had anything like that. I was contacted by Porter County. They have a new administrator, a new food supervisor, and a new environmental health supervisor. And a lot of new staff. They have a lot of new inspectors. And they contacted us seeing if this was something we wanted to participate with them. And I have to say it was a great experience. We learned as a group and also learned this other department, getting to know that staff there. Also, because we have a lot of shared vendors and a lot of contractors that cross that county line back and forth, working together to have more of a common ground on some areas where it comes to food inspections and septic inspections or permitting or anything, trying to work more together so there's more consistency. That's the word I was looking for, more consistency between the counties. Because Indiana, home rule state, these are our county lines and this is what happens within our county and we don't care outside. Well, that's not true. We want to have that communication there. So I put a picture in there to show that we actually all were there. Didn't strangle each other by the end of the day. Big thing was in December, we decided to have our open house for the laboratory. You have a couple of things that we handed out at the lab open house. And we have some reusable straws. And they have little brushes so you can clean them out. Because otherwise they're going to get funky. And that defeats the whole purpose. And also a hand sanitizer. I did put in a couple of pictures where we had some tables set up outside. We had microscopes outside the laboratory so you could look at ticks, and we had some little animal slides, blood slides you could look through the microscope. That's always fun. I don't know who doesn't like looking. Well, okay, there's probably people who don't like looking through a microscope, but and then the laboratory, our whole new chemistry area, or just at the lab remodel came through really, really nice. And we shouldn't have to do anything for the next 30 years, knock on wood. So our IDEM contract, applied for that in December for the 2020 beach season. We have another stop added. Stop 14 will be sampled regularly. The other stops in there, 24 and 37, which we weren't able to do regularly because of the beach erosion, are still in there for by some chance something happens and we have beach again and we're able to sample those, then we'll be able to do that. But the grant applied for was $10,259.08. Food protection was kind of crazy. We haven't had an administrative hearing for years for any of our foods. And we had 2 establishments that had to come in for administrative hearings because the one had been put on probation twice within a 12-month period, so they automatically have to come in for a hearing with us, and that caused them to be on administrative probation, meaning they have to be they get inspected 3 times randomly in a 4-week period. And they can't have any criticals, no more than 2 non-criticals, or they lose their license and have to start from scratch. They have to close down and we have to work out a plan. So we had 2 of those this last quarter. And we also had one for a swimming pool, which has only happened one other time in my tenure at the health department. We were also in court on the 22nd for a property in Hudson Lake. The property owner, there was a trash and garbage complaint, pretty bad conditions. The house itself, the windows have been busted out, the doors are opened, and unfortunately we have not been able to locate the property owner. The property owner did not show for the hearing, so we're waiting on final decisions and instructions from the court on seeing how we can get that cleaned up, because obviously we don't have that in our budget to go clean up junk properties or anybody to do it. We'd have to hire somebody to do it. Yes.
What's the address of that house?
It is 8299 East Emory Road in Hudson Lake. And we just got another complaint. Somebody else filed a complaint about that property again today, so we're gonna have to figure something out. I did put the numbers in there for the laboratory. For last quarters, our numbers are down a little bit from the last couple of years, and that's just us getting fully backed up and running in the laboratory and getting our clients back in. It was like all things planned with construction, it always takes longer and longer than what you actually planned for. So we're working on regaining that. Property transfers are still a very popular topic. I was asked to come in and speak 2 different engagements, one in October for the Urban Waters, and also Century 21 had me come in and speak with the Century 21 affiliate in Michigan City, come in and speak with all of their realtors as a refresher, how to properly take a water sample. There's a lot of confusion on how to collect that water sample without contaminating it, how long to let it set, and the filing of paperwork and everything. I was asked to speak. I haven't got any other details, but Urban Waters gained me a couple other speaking engagements, wanting us to come down, David Ortel and myself, to come down to Indianapolis in May to speak at the MS4 convention conference. So I'll update you on that. And does anybody have any questions?
Any questions? All right, do I hear a motion to accept the Environmental Health Food Supervisor's report?
Make a motion, we accept the
Is there a
report.
second?
Second.
All in favor?
Aye.
Thank
Anyone
you.
opposed? Nope, the ayes have it. Report is accepted. Health Educators Report, Ann Richmond.
Hello. Just one thing I would like to have the board understand is that I'm a department of one. So if I'm not in working, then my programs all stop. So just wanted you to understand that, because the fourth quarter, there's a lot of days off. We only work like 11 to 14 days in November. And then during Christmas, I take the 2 weeks off. I've been there 25 years, so I get 5 weeks vacation. So there's a lot of time off in the fourth quarter for me. I did want to let you know that the ECHO grant that TechServe and HealthLink applied for was not given to LaPorte County. They awarded 16 counties and we were not one of them. So I'm not sure what they're going to do moving forward with the ideas and programs that they wanted to start without having the money. Not sure if they're going to be able to do any of that. I did start working with the counselor in the jail to see if we can provide Narcan to those exiting the jail. So we're working on at least that part of it. That was one section of that ECHO grant. The money for the car seat program this year, they're going to do something different. They did a pilot program last year where they drop shipped seats to one location, and then the permanent fitting stations picked up seats from that location, which happened to be LaPorte Fire. So they are going to continue with that and try that this year, which I'll be able to get a lot more seats this way, because in the past, with the grant money coming to us, I could only order from Evenflow because they're the only company that would bill us. We don't have county credit cards. I couldn't go to Walmart and get as many seats as Walmart would offer at their discounted prices. I had to pay full price institutional pricing through Evenflow because they're the only ones, the box stores, none of the box stores would bill. So I had to order through Evenflow, and with them being able to drop ship seats, then the money, they're doing all the purchasing of the seats. So they can purchase a lot more for me for LaPorte County. And LaPorte Fire is very close. We'll be able to get them from them quite easily. In November, I don't know why, that we tried to do a car seat event in November, and I actually got a volunteer from the health department to help with it. It was freezing outside, but we did want to do a booster bash at Head Start. They're 4-year-olds, so they should still be in boosters. They do have 3, 4, and 5-year-olds there, but we're focused on the 4-year-old because that's their biggest population, just to get those kids in booster seats. What Head Start didn't realize is how long it takes to do each fitting for each child. Our first van had 3 kids in it, and my other tech that was coming showed up, and it took a long time just to get that one van done. So we weren't able to do a lot of folks at that booster bash. Unfortunately, I still have trouble getting techs coming to the event, so they don't get paid. They only get paid for that National Child Passenger Safety Week. That's the only week out of the whole year that they're able to offer the $50 stipend for techs to work events. So any other time, they're doing it out of their passion for keeping kids safe in car seats.
How long does each one of those fittings take?
It really depends on what you're faced with. So if there's no problems and you're just teaching them how to install a seat, about 20 minutes. You have to evaluate whatever they have and write down all the information on the current seat that they have. And then for each child, so there's the whole big long paperwork process for each seat that you have to do. And a lot of times seats have to be moved. If you're recommending the youngest child's in the middle of the car and they're currently not, then sometimes we have to move seats around to get the best practice. So it just depends. So we only had 2 techs at that event, so we didn't get very many people seen. I did pass out the numbers for 2019. We had a total of 106 seats that we were able to replace, and with 16 seat checks. So how they do the numbers, I might have said it before, any seat that is replaced, that is 1. If you're just doing a seat check on it and the seat isn't replaced, then that's just the seat check. So how they do their numbers is a little bit different than what you would think if we just said how many car seats. That's what the report that I got from St. Anthony's when we did their event there. She just said we serviced 63 children and replaced 47 seats. So I'm not sure how that broke down for them. We supplied booster seats for them, and I also did work that event as well. But for the whole year, we did 106 seats with 16 seat checks, and we had families that had 2 or more kids checked was 24, and 8 of those 24 had 3 or more kids. So when I'm doing them by myself at the office with 3 kids, it takes a long time. So just wanted to make you aware of that. That's all I have.
Any questions? Okay, is there a motion to accept the report from Ann Rissman for the health educators report? I hear a motion to accept.
I believe we should accept the motion, the health educators report.
Okay, is there a second to that? Okay, do we have a vote on that? All in favor? Aye?
Aye.
Anybody opposed? No. We accept the report. Thank you. And the attorney's report.
I don't have anything to report tonight. I do thank you for the appointment, and we look forward to continue working with the board and assisting in whatever we need to help with. So thank you.
Thank you very much for your service. All right, County Council Liaisons Report. Welcome.
Good afternoon, Mike Mullenauer, County Council. Just got a couple things. First thing I wanted to comment on was the lab, and of course Tony already mentioned the tour. I think that was really great. I had a lot of good feedback on people that really appreciated seeing it, councilmen as well as public, and it is quite a change, big difference up there, so we're glad to see that. And he also reported on the, I think it was 6 employees that come from Comet 2 to Comet 4. And I think the council voted unanimous on that, which glad to see it went before the committee, and glad to see that the council could give them, because they were really been neglected. Nobody's fault, just slipped through the cracks, I think. So, but they've got that raised. And then the one thing I wanted to report on was 2 things. The new ambulance base in LaPorte's coming along well. I think you've probably seen the construction beginning on that over there, where we're moving it. But also some, I think, real important new news is we're making good headway on the ambulance base for the east side of the county, for the Rolling Prairie area. I know it's been talked about for a long time. We all agreed that they really need one over there to cut down immensely on the response time where they have to come from LaPorte. And last year, the county council funded 6 new EMT employees, EMS and EMT employees for that base when we could acquire it. And also an ambulance was donated. Large generous donation was received from a citizen here in LaPorte. So that really helped with the council being able to fund that additional funding for them 6 employees. So I think we're pretty well set. All we needed was property, and Shaw Friedman's been working very diligently on that, getting some property, and we've just learned that the property has been acquired. I can't say exactly where it's at, but it's over in the Rolling Prairie area, and which is where we wanted it, because that's it's going to cover the whole east side of the county, but that's the populated area, more so up to the north there a little bit, the New Prairie area, and hopefully now we'll be able to get some money okayed this coming year for construction of that. And I know that's hopeful, but we got the ambulance, we got the people, so it's time to get some service over there for those people to be able to, like I say, they got service now, but not the kind of response time that's really been neglected, I guess. So, and I think that's all I got. Any questions? Thank you.
Thank you, sir. Anybody have any questions for Mr. Mullenhour? If not, is there a motion to accept his report? Do I hear a motion?
I move we accept his report.
All in favor? Is there a second?
Second.
All in favor?
Aye.
Anyone opposed? No one's opposed. Thank you. Your report is accepted. Any old business that anybody has on their mind? I don't have anything on our agenda, and I talked to Mr. Mankiw, so we don't have anything. But I just want to make sure there's nothing old business-wise. New business, moving along, I did want to bring to your attention that we heard from Attorney Deb Chubb. She's in our community, has been very involved in lead issues and kids and child safety and lead. And she has been working along with the health department and the board, and had some very good ideas. There's been follow through and follow up by the health department, and there's some meetings planned in the community to see if we can't expand some lead screening for little ones. So I just wanted to make that known publicly, that that work continues, and we are working alongside members of our community who are very interested in this issue. Other than that, I don't have anything new. If no one has anything new, then I think we can pick a date for our next meeting, which would be in April of 2020.
Before we adjourn,
Yes.
I'd just like to say that today's my last day as a health board member. I accepted a job offer that might conflict with my membership on the board, so today's my last day.
We're sad to lose you. Are you happy about this job?
I am.
Sounds? All right.
I am.
Well, then, yeah, we're happy for you, but
Yeah.
we're sorry that, we're losing you.
It's been a pleasure. It's been a pleasure.
I think we started about the same time.
I think I started a little bit before.
Did you? Okay. All right.
I think Dr. Hawk and I started around the same time.
Did you really?
Yeah.
Oh my. Okay. Oh my.
It's been a while, but
Time just fly.
yeah.
Well, thank you for your service, and I really appreciate
Thank you.
everything you've done, and we wish you the best of luck in your new career.
Thanks.
Thank you. Wow, so many changes. Anything else new? If not, then I would like to pick a date with everyone here for our next meeting in April. And the week of the 14th, that Tuesday runs in with Easter. What about the 21st?
It's fine.
Is there anybody with a conflict for April 21? If not, is there a motion to accept April 21 as our next meeting? Do I hear a motion?
Motion accept.
What? You move it?
Motion accept, maybe.
Is there a second?
I'll second that.
All in favor?
Aye.
Anyone opposed? No. Okay, April 21st is our next LaPorte County Board of Health meeting. With that, since there is nothing left to discuss, the meeting will be adjourned. Thanks, everyone.